Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today. In this four-part of Equine Viral Arthritis series, we will clarify, discuss, and explain the pathogenesis of this disease. Pathogenesis of equine viral arthritis disease. Incubation period of equine viral arthritis disease will be different according to the sources of infection and the way of transmission. Following respiratory spreading, incubation period will be 2 to 3 days, while post-venereal spreading is usually 6 to 8 days and may be up to 14 days in some cases post-venereal spreading. Post-respiratory infection, equine viral arthritis virus replicates in the pulmonary macrophages and then proliferates in macrophages and endothelial cells of the lung and the bronchial lymph nodes, from where it rapidly spreads in the circulation to endothelial cells and macrophages throughout the whole body. Equine viral arthritis viruses replicates mainly in the macrophages and epithelial cells. It causes necrosis of intestinal cells and muscle cells in the arterial media, causing advential edema, which leads to lesions occur in small arteries of approximately 0.5 micrometer in diameter, especially in intestine, spleen, lymph nodes, and adrenal capsule. Better understand of equine viral arthritis virus host interaction in the reproductive tract and the viral mechanisms of immune evasion at the site of persistent infection, characterization of the host mucosal antibody response to equine viral arthritis virus during persistence is of utmost importance. Hypotheses about pathogenesis of equine viral arthritis virus denote to their escape from antibody-mediated neutralization in the reproductive tract and consequently continues to be shed in semen of infected stallions. In this hypothesis, characterization of mucosal antibody isotype response to equine viral arthritis virus during persistent infection and identified presence of equine viral arthritis virus specific neutralizing immunoglobulins in the seminal plasma. The further demonstration that equine viral arthritis virus employs a complex mechanism of the immune evasion during persistent infection in the reproductive tract, with successful viral escape from systemic humoral and mucosal antibody responses, as well as local inflammatory responses. Although endothelial cells and macrophages clearly are principal sites of equine viral arthritis virus replication, selected epithelial cells, mesothelium, and smooth muscle cells of the media of the arteries and the myometrium also may be infected. Systemic panvasculitis is a characteristic histologic feature of severe viral arthritis, although equine viral arthritis virus infection of pregnant mares can result in abortion, pathogenesis of fetal infection, and the mechanism responsible for abortion are not adequately defined until now. Developing to an immunohistochemical staining procedure utilizing equine viral arthritis specific monoclonal antibodies, and to use this procedure to localize equine viral arthritis virus in the tissues of an experimentally infected pregnant mare and her fetus may give an answer about the pathogenesis in the genital tracts. This is schematic diagram of equine viral arthritis pathogenesis. Equine viral arthritis virus spread through inhalation of respiratory droplet, venereal transmission between mares and stallions, transplacental from the infected mares to the foals, where the virus, after multiplication, will cause viremia, then goes to blood vessels, causing severe vascular damage in small arteries, eyes, intestinal tract, visceral lymph nodes, adrenals, and ureters. This leads to hemorrhagic enteritis, blindness, pulmonary edema, and/or abortion. Death due to dehydration and anoxia is reportable. This schematic diagram shows clinical and laboratory findings and sequential pathogenesis of equine viral arthritis post-respiratory infection. Vertical bars correspond to the chronologic occurrence of respective clinical or laboratory findings and the distribution of the virus in body tissues and secretions. Fever here noted between the days of 2 days up to 12 days. Lymphopenia reported at the 4th day post-infection up to the 10th day. Edema reported at the 5th day up to 9th day. Neutralizing antibodies reported from the 6th day of infection up to 40 days. Nasal secretions noted from the 3rd day up to 14th day. The puffy coat and the virus present in them reported between the 1st day and 19th day. Presence of antibodies in the serum reported between the 4th day up to 7th day. The virus shed in the semen beginning from the 7th day up to 40 days. Abortion noted between the 9th day of infection up to the 30 days post-infection. Natural and experimental equine viral arthritis infection induce a robust and protective immune response. The innate immune response has not been comprehensively characterized. Recent studies have demonstrated that equine viral arthritis virus inhibit type 1 interferon production and thus subverts the innate immune response. It has been shown that 3 non-structured proteins, non-structured protein 1, 2, and 3, have the capacity to block interferon senses, with noticeable that non-structured protein 1 excreting the strongest effect. Post-infection, both equine viral arthritis, specific complement fusing CF, and neutralizing viral antibodies develop with production of long-lasting immunity and protection from reinfection with most viral strains. Both complement fusing and viral neutralizing antibodies developed between 7 and 14 days post-infection, then peak either after 2 to 3 weeks or 2 to 4 months post-infection respectively. complement-fusing antibodies steadily decline by the 8 months post-infection, while viral neutralizing antibodies persist for 3 years or more. Both structure proteins, GB5 and M, and the non-structure protein 12 induce humoral immunity. Structure protein 5 contains 4 major neutralization sites A, B, C, and D. Structure proteins 5 and M heterodimerization is essential for induction of antibody responses and protection. Despite presence of high neutralizing antibodies, the equine viral arthritis virus persists in the reproductive tract of carrier stallions. Viral evolutionary mechanisms take place during persistent infection in the reproductive tract, leading to the emergence of genetic variants with distinct neutralization phenotypes due to amino acid substitutions in the major viral neutralization sites, and thus conferring the ability of the virus to successfully escape humoral immunity. Foals born to immune mares are protected against clinical equine viral arthritis by passive transfer of viral neutralizing antibodies in the colostrum. Viral neutralizing antibodies appear in the serum of newborn foals a few hours after colostrum intake, level peak at age of first week, and titers decline to extinction at the age of 2 to 6 or rarely 7 months. The mean half-life of equine viral arthritis maternal antibodies in serum from foals is about 32 days. The last experimental study at 2018 about the cell-mediated immune response to equine viral arthritis virus infection cleared that it induces a specific cytotoxic CD8 T lymphocyte, and their precursor may last for at least a year following infection. This is the end of the fourth part of equine viral arthritis disease. Please subscribe the channel to get the rest of the series about this disease, as well as the most recent informations about infectious diseases of all animal species all over the world. Thank you for subscription and listening.